My name is Dr. Ranjani Ravi, and I am the consultant nephrologist at Cosmopolitan Hospital, Trivandrum, Kerala. Today, I'll be talking on the topic chronic kidney disease, that is CKD and edema. Now, when we talk about chronic kidney disease, the word chronic itself means something which has been there for quite a long period of time. So when we talk about chronic kidney disease in nephrology, we generally mean a kidney disease that has been existent for at least 3 months. Now, the kidney is a very important organ of the body, the main function of the kidney being removal of excess waste, toxic and metabolic products, removal of excess water from the body, and excretion of this as urine. So obviously, when the kidney is not functioning properly, there is an accumulation of these toxic and metabolic waste in the body, and there is an accumulation of excess of fluid as well in the body. Now, this excess fluid, this is what we call as edema. This edema, that is this fluid accumulation, usually if the patient is walking, this accumulation tends to take place in both the legs of the patient. If the patient is in a lying position, it can present as puffiness of the face. It can even present as a fluid accumulation in the back, anywhere basically that the gravity dictates the fluid should. Now, this fluid, in Kerala, we call it as neeru. In Tamil Nadu, we say vikam. In North India, we call it sujan. Whatever we call it, this fluid accumulation is one of the most common symptoms with which the patient presents to a doctor. But what I must emphasize is that any swelling of the legs or any puffiness of the face is not always related to a kidney disease, and it can be caused by problems of the heart, it can be caused by problems of the liver, there may be varicose veins. There are so many reasons by which this edema can present. So it is most important to first recognize the fact that the patient has a fluid accumulation edema and then to evaluate it. For a kidney disease, maybe even a simple blood test or a simple urine examination may be enough to ascertain that it is due to the kidney or not. But what is most important is that the patient should recognize it and go to a doctor so that he can be evaluated and it can be ascertained to it what the actual problem is. Now, this accumulation of fluid, not only does it cause a lot of discomfort to the patient, it is also a little dangerous because it can predispose to infection. The fluid anywhere in the body, it attracts bacteria and there can be infection at the site. Also, if there is a real excess of fluid which goes to the lungs, the patient may have difficulty in breathing. The oxygen saturation of the patient may drop, and it can even lead to life-threatening complications. So it is very important to treat the edema properly. So when we talk about treating this edema, treating this fluid accumulation, the first and foremost step is that we restrict the water intake of the patient. Now, when we talk about water intake, it's not exactly only water that we mean. We mean any sort of fluid, any sort of liquid, whether it be coffee, tea, milk, anything that the patient drinks, we ask them to restrict their fluid intake. In fact, we usually ask the patient to restrict it to around 4 or 5 glasses per day. Along with fluid intake, we also restrict salt. Now, as you know, salt and water are usually best friends. If you eat more salty food, you crave more of water. And in the same way, if the body has excess of salt, it tends to retain more of water and less of water is lost as urine. So salt causes a lot of accumulation of water inside the body, and this salt intake must be restricted. In fact, we ask our kidney disease patients to restrict salt to around 4 grams per day. So this is roughly a leveled teaspoon of salt. And this is for the entire day. Now, some patients, even with fluid and salt restriction, they still tend to have edema. They still tend to accumulate fluid. And these patients are usually the ones who require drugs to reduce their symptoms. So we use this class of drugs known as diuretics. These medicines known as diuretics, the function of which is they act on the kidney and they help the kidney excrete more of water. They excrete more of salt into urine. In this way, they also help reduce blood pressure as well. However, if we use too much of diuretics, if we use too much of these drugs, this also can be counterproductive, and these can lead to complications, and these can even affect the kidney adversely. So they should always be used with caution. Now, some patients, even with fluid and water restriction, even with salt restriction, even with diuretics, they still tend to accumulate fluid in the body. Some of them who have swelling of legs, if you keep the legs at a higher position, some amount of the edema may be alleviated. However, Once the patient puts the legs down, again this edema will accumulate. So for patients who have a very advanced renal failure, for whom fluid and salt restriction, for whom drugs are not helping, we always have the option of dialysis as well. Now, whatever be the cause of edema, whatever be the cause of chronic kidney disease, it is very important that this must be evaluated and treated. To end with, I would like to say that chronic kidney disease is not very uncommon. It is becoming more and more common these days. However, what is most important is that now we have drugs, we have various modalities, we have dialysis, we have transplant, we have so many other modalities in which we can treat chronic disease, and kidney being so important in not only the waste management, not only in fluid management, it also helps in the mechanism, in the metabolism of various other things like calcium, phosphorus, acid base, even the production of RBCs. And there are so many modalities by which we can treat this disease, and we can treat the symptoms of patients with chronic kidney disease. So most importantly, it should be recognized. The patients should be on medical treatment, and definitely we can go further in helping them live a better life. Thank you.